A fight over health insurance and workplace safety has thousands of Twin Cities nurses ready to go on strike beginning Monday.
Nurses at 5 Allina hospitals plan to hit the picket line on Labor Day, and they say they will stay there as long as it takes. About an hour ago, a community rally in support of the nurses began in Stewart Park in Minneapolis. Nurses represented by the Minnesota Nurses Association voted on August 18th to authorize this open-ended unfair labor practice strike. Our Angela Davis is live at that rally in Minneapolis, and she has an update for us. Angela, what's going on?
Hey there, Frank. Well, as you can see, there is a crowd here, about 200 people here at Stewart Park in Minneapolis. We've seen union leaders, political leaders, as well as many of the nurses who plan to go on strike Monday morning. Now, there is one last chance to avert that strike. On Friday, there is a negotiating session that is scheduled between leaders of Allina Health as well as negotiators who represent nearly 5,000 nurses. In June, Allina nurses staged a one-week strike to show they mean business. But if there is still no agreement on a new contract by the end of the week, nurses at United, Mercy, Unity, Abbott Northwestern, and Phillips Eye Institute could strike for much longer.
We've been at this since February, and unfortunately we just haven't come to an agreement yet.
Angela Pichetti is on the negotiating team for the Minnesota Nurses Association. She says nurses need more resources, better staffing, and better security.
I think we need our voice out there. They need to address these. Nurses are getting hit, kicked, punched, and spit on, and unfortunately, Allina just isn't addressing it. So it's key issues that are close to our heart that we want out there.
A major sticking point is Allina's plan to move its nurses to a new benefits plan. It would save Allina millions of dollars a year.
The current nurse-only insurance plans were designed over 2 decades ago and really don't reflect the way sort of health insurance works these days. Their costs are spiraling out of control, and it's really unsustainable for us as an organization to continue to fund those plans.
David Canahan is the Director of Communications for Allina Health.
I think the good news is we have really good alternatives in the form of the Allina Health core insurance plans. They're providing excellent coverage for over 30,000 other Allina Health employees and their families.
The nurses' one-week strike in June ended up costing Allina more than $20 million as it had to hire temporary nurses to maintain services at their hospitals. Right now, we're giving you another live look at this rally in support of Allina nurses. It is scheduled to go until 6 o'clock this evening. We do know that a federal mediator will be at that meeting on Friday, that last chance to reach a deal. If no deal is reached on Friday, we're told that those nurses will begin the strike at 7 o'clock on Monday morning. Monday, as you know, is Labor Day, and they will have picket lines at each of the Allina hospitals affected by this. And as for Allina, the company is saying they have been in contact with companies, and they will have replacement nurses ready to go to work on Monday. Frank and Amelia.
All right, Angela, thank you.